Welcome to Skin, Face to Face. This is going to be our roundtable series where we're going to do a deep dive on the most common questions asked around skincare for pregnancy, trying to conceive, breastfeeding and postpartum. We're joined here today by our amazing advisory board, Professor Caitriona Ryan, who's our consultant dermatologist, and our GP advisor, Dr Raj Arora, and our beauty editor, Bridget March, who's going to be taking us through all the questions today.
So we're going to start talking about fertility and skincare and whether beauty products can actually affect our fertility or not. So perhaps maybe we should first talk about how and whether skincare enters the skin, enters the body through the skin. Is that a myth or is it not?
No, it's absolutely not a myth. Certain skincare ingredients can be found at detectable levels in blood, in parts per million blood. We learned a lot about that from sunscreen data, especially chemical sunscreens, studies that were done by the FDA a few years ago. So it is very important what we put onto our skin because it can be detectable at certain levels in blood, especially if it's done over a large body surface area.
Yeah, agreed. And I think sometimes the point to make is that if you're not aware of that and you're using specific skincare, which could potentially be damaging if you're trying to get pregnant. And I think a lot of patients come in with those question marks now. So it's really important. People are more aware of what's going on in their skin, what effects it has on fertility, pregnancy, postpartum. And it's important for us to be able to relay that message. Yeah.
And I think it causes an awful lot of concern for our patients as well, because it's very hard to actually to work out what you can and can't do in pregnancy. It's one of the commonest questions we get, actually.
Yeah. I mean, actually, you're medics, so it's going to be slightly skewed here. But, hands up, who kind of thought about their fertility and their skincare when they were perhaps trying to conceive? Was it something that sort of crossed your mind, or were you worrying about different things that could be affecting it?
I think for me it wasn't until I knew I was pregnant, and I think that's important too. A lot of people can be trying to conceive for years sometimes, especially people on a fertility journey. But I think it's really important to be aware of it as soon as there's a potential that you could be pregnant.
And I think when you're trying naturally, you're probably not really thinking about it too much. But when you are going through IVF and everything is very much heightened, I think that's when you're probably a bit more conscious of what you're putting in and on your body. But I didn't know you couldn't use certain ingredients until 6 months pregnant, let alone being trying to conceive. So I think a lot of women out there don't really know or aren't really aware of the fact that they should probably be thinking about that pre-pregnancy.
And I think patients come into clinic often and the questions they're asking, certainly the GP, are things like what minerals should I take, what vitamins should I take, what sort of diet should I have. There's never really a conversation around skin. And actually, when I was trying to get pregnant, I also didn't really think about skincare until I had quite a struggle getting pregnant with my first. So it then got to like a year of trying. And I was like, it's not happening. At that point, I had done the vitamins, I had done the diet, I had done the exercise. I was really looking after myself. And then I was getting paranoid, thinking maybe it's my skincare. And that's when I started to think about skincare as well. Of course, it was none of that. I actually had a condition. But actually, I think it takes a bit of a journey sometimes before women think about skincare being related to pregnancy or conception. And although there is awareness around it now, it definitely has taken, I think, a good decade for that to come to light. And
actually, what's interesting that you just said there, I think if somebody went to their doctor and asked about skincare, most doctors, unless they're in the dermatology world or GPs that have a special interest in dermatology, wouldn't be able to tell a patient what they can and can't put on their skin. So there is a huge gap in education there, not just in the lay community, but also I think amongst doctors.
In the healthcare, definitely. And I think that's one of the big key facts. And actually you saying that, because I remember a colleague of mine coming into my room and saying, this patient just asked that very question, what would you say? And obviously, because I'm in skin, I said, okay, these are things that you should recommend. But there definitely needs to be more education around that, I think.
And midwives,
across the board.
They're the first people that pregnant women go and see.
Absolutely.
So they also, I know, speaking to midwives myself, when I was pregnant, but also when I was doing all my research for Skin to Skin, they're really not educated on it, and not, it's not part of their curriculum or whatever, but I think it's just trying to broaden that awareness, isn't it?
And I think the other thing to remember is most people are pregnant before they know they're pregnant. So, and sometimes it's the 2 weeks before they do the pregnancy test. But I've had lots of friends who didn't realize they were pregnant for 3 months. So I think if you are actively trying to conceive, you need to be having this conversation at least, or doing your research, because it's those crucial first 8 months when 8 weeks, that when the organs are being formed.
Created,
So it's important, if you think that you might be, that you're open to being pregnant and you're not using contraception, you have to think about your skincare.
That's actually a really good point. When is it the most important to be thinking about your skincare during trying to conceive, or even during pregnancy? They say the last couple of weeks or months, it's fine, you can have a drink or you can eat whatever because the baby's kind of developed.
Yeah, it's organogenesis, and I suppose the big thing we think about in skincare is vitamin A, any topical retinoids, and those the damage is going to be done in really in the first 12 weeks. More than any other time. So
it's unlucky, because that's sometimes when you don't know you're pregnant and you're still taking your supplements or using your retinol or whatever. So
absolutely, yeah.
But I suppose if you are, struggling to conceive and undergoing IVF, or I had assisted conception treatment with my first 2 babies, you're hyper aware of all those things. But there's a fine line, isn't there, between being paranoid and feeling like your life's on hold and you can't, you're stripping back all those pleasures of, I can't do this and I'm not doing this and I'm not doing that. But you kind of want to upkeep your gorgeous skincare routine and something that's going to work, instead of sort of stripping it right back to nothing. So,
well, especially because that journey can go on for an awfully long time, unfortunately, for some people.
Yeah.
A lot of people aren't successful on their first round or whatnot. And I think the important thing to know is that you can still have excellent skincare when you're pregnant and trying and everything else too. It's just knowing what you can and can't do.
Yeah,
I think it's not been bottled as easily, I think, for the consumer. I think, for those who are a bit more savvy with skincare, certainly they'll come into clinic and say, I'm using my low dose salicylic acid, I've stopped my retinoid. But not everybody has that. And I think having something like Skin to Skin there on the shelf, which is ready prep, to go, if you are going through a long IVF journey and you're struggling, you don't have to not have the pleasure of doing your skincare. If you know something's safe, it's going to work for you. It makes, I think, our lives easier as doctors in some ways, because you can say, actually, there's a skincare range that we would recommend. Go and use that.
And you know you're safe there.
Yes, and we haven't got
taking
to
the
pick
guesswork
away.
out, isn't it?
Absolutely. So I think that's definitely, a plus point.
Well, especially if you're telling a patient what they can and can't do, but then there's, they go and look, they're checking it, like every skincare product, the big list of chemicals, and chemicals can be called different things. So I think we can give them the information, but then it's still really hard to navigate.
It's like they need a science degree.
Yeah.
So
Yeah.
again, I think what Sarah's done is amazing, because it just, people don't have to think anymore. They know that this is all safe, and I don't have to check the label. I don't have to do anything else. I know I'm okay when I'm using this stuff.
And we're all moms, so we all know that we have a lot on our mind.
Yeah,
This is
exactly.
all one thing that we can just, it's like gluten-free, dairy-free on packaging. It's like you don't have to think about it. It's there, it's safe, you can use it, and it's active, and it's going to help your skin and those kind of skin issues that you're getting, especially through IVF. I think IVF is, a crazy time for women.
Yeah, it's a turmoil for a lot of people. And, like you were saying, you might get the advice from your GP of cut out retinol, and it's like, yeah, but what else? And if you're not the sort of skin intellectual, going on all the Reddit blogs and stuff, and you don't know, I think the next thing that kind of comes into play is like you're worrying about endocrine disruptors and stuff like that. Is that something that you guys are going to get asked a lot about when people are trying to conceive and struggling to conceive?
I think, Caitriona, you might be better placed as a dermatologist to answer, but as a GP, my perspective is that patients only really come in to ask about endocrine disruptors if they are more educated on their skincare journey, and if they have learnt about the potential of certain ingredients to impact their fertility, for example, they are then more interested in what's an endocrine disruptor, how does this affect my skin, my fertility. in which case we will talk about it because it is a thing, right? So I think it's important to raise that awareness. But again, it's not everybody knows about what endocrine disruptors are, how they work, how they might impact not just fertility, but other areas of your, your health as well. So,
yeah, what are they then?
So
maybe let's backtrack.
It's typically chemicals that at certain percentages can affect your reproductive potential. Now, to be honest, I think there's a whole lot of nonsense out there about endocrine disruptors, and a lot of things that are being pushed as potential endocrine disruptors that really aren't in the levels that we use them. I think a good example is essential oils. Now people are afraid to have scented candles. They're afraid to have, to have a massage that involves an oil. There's a lot of misinformation out there and things that people are picking up on TikTok as well. I think, the important ones are things that we know at the levels that we're putting on our skin that could affect reproductive potential. And one that I feel strongly about as a dermatologist is chemical sunscreens. Yeah. I think that is important to avoid because we know after just one day of normal use on the entire body, you've got detectable parts per million in the blood. So that's one I particularly would avoid. But yeah, there's a lot of misinformation out there.
And I think that the misinformation then fuels that, scaremongering that everything has an endocrine. I mean, I'm on TikTok for that very reason, to bust misinformation, although I didn't ever plan to be a TikTok doc. But I do think it's an important place for me to meet people, because actually that's where they are, and they're picking up all this stuff that, a very sort of normal, general moisturizer, for example, that can do lots of benefit for skin. Somebody might pick it up and say, well, this has got this in it. They'll break it down and say this is an endocrine disruptor. I think it's really important to be mindful that there are some things like, Caitriona, you said chemical sunscreens that I think are a no, you should be opting for mineral sunscreens if you're pregnant. And there are some things that are not going to, impact your body, your skin, your organs in that same way. So there is a grey area, and there's lots of scaremongering. But yeah, endocrine disruptors are a thing. But again, like everything, there's a barrier, isn't there? There's a level at which we need to be facilitating.
Yeah, I think one of the ones that a lot of people see, and I know you're paraben free, which is great because people, are worried about different aspects.
Yeah, I was just going to ask you parabens. That's a biggie.
Yeah, at the levels that we use in skincare, they should not disrupt reproductive potential.
So is the devil in the dose? Is that what we're saying?
Yeah.
It's all about,
And I think
levels.
Pregnancy is one, because it drives people mad. It drives me mad anyway, but it drives dermatologists mad as well. Things that are great in skincare, and have really important functions are like kicked out of what we can do anymore, and for no good reason and without good data. But I think pregnancy is one time that we prefer to err on the side of caution with everything, because if we're awaiting more data, then we'll just play it safe. So I think, unless we know something is completely safe, I won't recommend it. And again, this is another great reason, to be able to use this now, because there's so much we don't know yet.
So much. And I think you're right. I think that whole idea of, as doctors, we act on patients' best interests. It's all about risk versus benefit, and the blanket answer is, and sometimes it's frustrating, especially if you're pioneering or you are somebody who wants to push the boundary a little bit, but you don't, you've always got to be careful. And I think with myself, for example, in pregnancy, I didn't know I was pregnant, so I was actually using retinoids the first couple of weeks. I then stopped. I went to lower dose salicylic acid because I had breakouts. Again, I wouldn't recommend some things that I did in my early pregnancy to everybody, only because I know there isn't enough data for that, which doesn't mean it's wrong. It just means that we can't safely say it's in your best interest to a patient. But to my patients, I will always say, look, we don't have enough safety data on this. Doesn't mean it's bad for you per se, but what it does mean is that I can't say to you without doubt that this is beneficial over risky, and so if that's the case, we're going to be safe, and that's how it works.
And I think with pregnancy, it is a time when women are very, very vulnerable, they'll feel like intense guilt at doing anything that could harm their baby.
Totally.
So, and then
especially going through fertility treatments.
Absolutely.
Yeah, because you're just blaming yourself the entire time, the whole way.
As women, we do that. We were talking about this earlier. We just blame ourselves for everything, every little thing. And if that cycle failed, was it the fact that I used that cream, or I ate the wrong thing, or whatever it might be? So I think we, that's why I think for the sanity of patients, it's important to say, look, it's not worth you taking that mental load. There's a lot more going on. Just be safe. And I think that's, again, another reason why skin to skin is great, because now we can say, look, here's a skincare range that we know works. It's active. It's going to do wonders for your skin.
And you can still indulge. And you don't have to take all the pleasures out of life. You can still have beautiful skin.
Yeah, and it's active ingredients that are going to work. It's not just like, you know, feels nice, strokey.
Nice,
yeah, exactly.
You know, another thing I think is very difficult on the fertility journey is, yes, you're depriving yourself of things, but also your skin can go absolutely bonkers during fertility treatments. And I think it's something that a lot of people who start on the journey don't realize. And then they have awful breakouts. It's usually hormonal breakouts, and it's to do with the hormones that we use to stimulate the ovaries. And particularly progesterone can give you awful acne breakouts. It can actually cause hair loss as well. So on top of the stress of the journey, the IVF journey, then you're covered in acne maybe as well, afraid to use anything to treat it. And actually the stress of the journey, and maybe the stress of the breakouts as well, the cortisol release can compound the acne. So having skincare that is anti-inflammatory but pregnancy safe, I think, are really important as well. And a lot of the products within Skin to Skin are full of anti-inflammatory ingredients too, which is really, really helpful.
So would your approach to one's skincare during a IVF or assisted conception journey be the same as your approach in pregnancy, would you say?
Certainly from the time of the transfer on, absolutely. It has to be pregnancy skincare. In the lead up to it, we can use, very much the same as what we're doing pre-pregnancy. But what's different often is the irritability of the skin and the tendency towards breakouts. So using things that are anti-inflammatory, can make a big difference to even preempt it from happening.
I think essentially that piece there before you conceive via IVF or conception is that you are going to have that burst of hormones a lot earlier. So when you get pregnant, and naturally, then your progesterone levels start to rise, whereas you're already being given those kind of medications beforehand. So even before you've conceived, and if it's been successful, you're having progesterone and you're having these hormones that might then cause the acne, also acne scarring from that, the redness, irritation. So I think if you're on a skincare program already, a lot of my patients say, what should I stop? What should I continue? And I might be more inclined to stop even the acids that are okay during conception, and normally if you're conceiving naturally, I might stop those sooner or reduce them because of the irritation on the skin. And that's
it does hit you really quickly.
That's it.
Like from the day I got pregnant, it felt like my skin changed.
Yeah.
And that's where it's nice to give a little alternative and say, I'm taking this away, but I'm actually giving you this that has like azelaic, for example. It's, it's an azelaic derivative. It's not going to be as irritating. And I think being able to make that swap really makes the patient feel empowered, that I'm not completely losing myself in this journey, because you do feel lost
100%.
when you're going through an IVF cycle.
And rosacea can go bonkers as well. We've a ton of rosacea in Ireland, 10% of the population. So the
10%.
So curse the
sensitive
Celts.
souls we are.
But having actives during a rosacea flare is terrible as well. So again, having azelaic, and actually Skin to Skin has the azelaic derivative that doesn't cause the irritancy that we sometimes, I find that a big problem in Celtic skin as well with azelaic acid. So we've got a better version of it. And the other lovely thing is being able to have collagen stimulators that aren't retinoids as part of the journey. Because I think that, coupled with not being able to do maybe some of your cosmetic procedures, knowing that you're doing something for the anti-aging process is huge.
And I definitely feel you age about 10 million years after having kids, or even pregnancy. It's exhausting.
Tell me about it.
So anything to help you there.
Yeah, totally. So let's actually just cover off kind of some ingredients that you definitely want to avoid when you're trying to conceive, or when you're having fertility treatment, let's say, and trying to conceive in general, I suppose, because we talked about chemical sunscreen. So parabens, kind of, if you can go for a paraben-free product, probably ideal, but we're not saying it's a total no-go, don't go there. But what would you say are the total no-goes?
Well, definitely retinoids. And that they're vitamin A derivatives. So the ones that you'd hear of are tretinoin, which is prescription, retinols, retinol palmitate as well. So if they're in any of your products,
Retin A, isn't it? Is that,
Retin A is the sort of trade name for tretinoin.
Is it? Okay.
Yeah. Retinol palmitate is in lots of products that people don't realize it's in because that's a less irritating form of a retinoid. So definite no-nos for those. No high concentration salicylic acid. That's really, really important as well. You can probably safely use things that are 2% or less, but again, if you don't need them,
It's also probably case by case, isn't it? It's like if you have really sensitive skin, then it's probably best to kind of avoid them.
And you can switch to other alternatives. So you can go for the lower percentage of lactic acids, or you can go for things like your azelaic acid, which is definitely a better alternative. If you are having breakouts, you can err on the side of caution, use benzyl peroxide, for example, at low percentages. So there are options available there. But like you said, Caitriona, retinoids are a no-go because of that vitamin A derivative, because of the fact that you are having that organogenesis happening earlier on. So you want to stop those retinoids.
I have a question. How long would it take for it to go out of your system or on your skin? So if you were using retinol and you were trying to get pregnant, how soon before getting pregnant would you stop it? Or is it immediate?
Matter of days. The half-life is, the half-life of most retinoids are about 20 hours or so.
Okay.
And that's if it was at a systemic level. So,
so it's quick.
a couple of days is fine.
Yeah.
How about supplementation? Because, when I got pregnant with my third, which was a big surprise after having fertility treatment first 2 times around, I'd been taking skin supplements with vitamin A and, all these things. I was like, oh, okay.
Yeah.
But
so oral vitamin A is going to be so much worse than topical.
Yeah.
Because we know it's going straight into your bloodstream. So that's really, really important. And I think a lot of people don't realize that they have vitamin A in their multivit. So that's why we have separate vitamin supplements for maternity. So really, really important. Absolutely no vitamin A.
And I say to my patients, I just say whatever, because a lot of patients are taking lots of different vitamin supplements. They take skin, they'll take immunity. So I just say stop everything and get onto the pregnancy one, because it's safe. So again, it's just about erring on the side of caution. So if you are taking it and you've realised you're pregnant and you've realised late, it's okay. You're pregnant, you realise now, and now is a better time to stop than not at all. So you stop and you switch, and that's what I always say.
And take your omegas. Omegas are one of my favourite supplements. So omegas, it's part of most maternity supplementation anyway, but great for your skin and hair as well.
I was going to say good for anti-aging as much as, because, we were sort of saying about there's not that much data that's definitive, because people don't want to test on pregnant women, and why would they? Who would want to be a pregnant guinea pig either? So, a lot of these things are, retinol is a no-go, but I guess a lot of the other things that you might want to cut out is because of the sensitivities, because of how your skin is behaving when the hormones are kind of going wild. So
your skin totally changes, as Sarah said, and things that may not have irritated your skin pre-pregnancy can during pregnancy.
And even post, it can continue.
My skin's completely different. I used retinol for years. It was bomb-proof. I could put cement on my face and I'd never react. And as soon as I had kids, I still can't go back to retinol. I try and I go, and it's so dry, it's so red. So
I think that's a lot to do with the whole essential oil kind of question mark as well, isn't it? Because not only is, some people talk about them being dangerous, but also it's the fragrance that can make your skin kind of highly sensitive. What's your take on essential oils and pregnancy or trying to conceive as well?
So the essential oil thing, it's all about concentration of it. So anything, in a mild sort of, it's that the essential oil, the reason I would tell someone to keep away from essential oils is more the irritancy issues. And actually, anything that's sort of from a plant. The biggest cause of allergic contact dermatitis or irritant contact dermatitis is plants. People have all this organic planty type stuff.
Natural,
oh my God, it's the bane of our lives.
And also just say that if you don't have that irritability with the essential oils, you're using it in a carrier oil and it's at a low concentration, that's fine. So you can do that. And actually, you might have a pregnancy massage where they use like a sweet almond oil or something, or an essential oil, mixed together at a very low concentration. But I think what I've seen a lot of is that contact dermatitis, they're coming in, your skin is anyway sensitive, you're using your really high concentration of lavender oil or whatever it might be, and suddenly you are having rashes.
They're trying to be all natural.
That's it, because you want to be natural, but actually, that's not necessarily best for your skin. Your skin's really reactive. during pregnancy, and that's kind of the advice I give. But yeah, I think also social media has kind of, again, blacklisted essential oils as this, you know, demon in pregnancy. But again, if it's used safely with advice from your skin derm or skin doctor, you can implement them. But it is a case of don't go high concentration and douse your skin in it because you think it's going to give you a better pregnancy, because that's just not the case.
Yeah. The other thing that's great to do during pregnancy is support your skin barrier to stop it being so unstable and irritable. So nourishing the skin barrier, it really helps. It really helps rosacea. It helps hormonal acne too, as long as you're using non-comedogenic, so non-blackhead forming sort of formulations. And again, you've addressed that so well.
Yeah.
I love all the ingredients in skin to skin, and I'm not just saying that because we're chatting to you, Sarah, today. You know, we see and skin barrier is very sexy at the moment, but it
and ours
really
are clinically
does
proven. Just want to say,
but in pregnancy, it makes such a difference.
So, what are your favourite ingredients for skin barrier protection?
I love glycerin in it too, and then hyaluronic acid really supports the skin barrier, and then niacinamide. Niacinamide is one of my favourite ingredients in everything because it has that anti-inflammatory activity. It also has an anti-aging action as well, and it nourishes the skin barrier. So
and it helps with hyperpigmentation.
It does, yeah.
It does, and it has that anti-inflammatory, anti-redness.
Yeah.
Again, though, looking at percentages, because obviously sometimes people go in really strong again.
Yeah.
So,
I could be irritating.
I heard niacinamide was great. I just, slapped 10% on my face. I'm like,
more is
go
not more.
slow.
Yeah.
And that's another reason why I think having a skincare range where it's already formulated, you're not going out looking for individual ingredients. It's there.
Yeah.
You've got the ceramides, you've got the hyaluronic acid, it's all anti-inflammatory, moisturizing, great for your skin barrier. So if you are having irritation or breakout, sometimes it's not always hormonal. It might be the sensitivity giving you the breakout as well.
And you know what else is in one of your moisturizers, the Ectoin?
Yeah.
Fab.
That's having a big moment as well, isn't it? Talking of sexy
a big moment because it's
ingredients.
So great.
It doesn't sound it, but yeah. So just thinking back to sort of, these kind of hero ingredients that you all, what was the one thing that sort of saved you all in pregnancy? Because for me, it was azelaic acid. The first pregnancy, I kind of broke out. I'd never had acne before as a teenager. And all of a sudden I was like, I'm 30 years old, I've got acne, what's going on? And it wasn't, I started product hopping, trying different things, and it just made it worse and worse. And it wasn't until I really sort of like doubled down on sensible, sort of quite boring products actually, and brought in some azelaic that it settled down. So that was kind of my go-to in my second and third pregnancies for when I had breakouts. The range wasn't around that. Well, I did start trialing in the third pregnancy, actually, the samples, which worked really well for me. But were there any sort of like hero ingredients that you guys found that you were like, yes, this worked for me in pregnancy?
For me, azelaic was a big one because I have really acne, oily prone skin, and I do use stronger acids on my skin, and that my skin can take quite a bit. And I use retinoids pretty much like every other day. So having to stop all of that meant my skin just went boom, I had acne. So azelaic acid really helped. And then on top of that, barrier repair. So having a really good ceramide based barrier cream was a savior for me. And those two things I think just got me through pregnancy. There wasn't skin to skin then. I had nothing else to really lean on. Yeah. And I used a really, really good mineral 50 plus sunscreen because I get melasma in pregnancy, so it flared up my pigmentation. So using a really good sunscreen helped me with that as well.
Yeah.
I'm really lucky. I didn't have any skin flares during pregnancy or post-pregnancy, and it'll never look good for a dermatologist to do something covered in acne. But I think I maybe did not have a flare because, and of course I'm going to say this, but my skincare is so good. It's basic enough, but it's using my gentle cleansers. I've always used a tinted zinc sunblock. I've always looked after my barrier really, really well because I have rosacea. So the one thing that I had to give up on was my retinoid. But because everything else, I was using all the ingredients of skin to skin really. Anyway, I have niacinamide in my skincare regimen too, and actually my skincare regimen didn't really change, but it's very similar to what's here. What I'm very excited about, what upset me during my pregnancy was not being able to use a retinoid. And that was more because of the I hate missing out on the anti-aging thing. So what I'm really, really excited in your line about is the astaxanthin. Like that's my it's a really, really exciting ingredient. And to be able to be building your collagen all the way through and having that really, really high antioxidant activity and anti-free radical activity, it's very good in what it does against UV damage too. I think that would be my hero.
Yeah, well, that Algactive Uplift, which it's in, is like a hero product or a hero ingredient. It does so many things. So I think that serum is going to be a hit, I hope.
Worthy of a Botox in a bottle kind of claim.
Exactly.
Yeah,
Well, there we go.
So if you can't have your Botox, you've got skin to skin.
Improving your tone and texture at the same time.
Amazing.
So it is amazing.
I definitely found a difference by reducing the steps.
Yeah.
I used to be an 8-step gal, and I was destroying my skin. My barrier was completely gone. And then as soon as I stopped using the high levels of retinol and the high levels of salicylic acid and not doing double cleanses, actually that calmed everything right down. But, I wasn't skin savvy in terms of what I can and cannot use, because I was only 6 months pregnant till I realized you weren't supposed to use any of it. So I was a bit late by then. But yeah, the azelaic acid was a go-to. Low levels of lactic acid as well. But it was definitely the less is more approach.
Yeah, so true.
We see that all the time, and I'm sure you do as well, Raj. Like acne cosmetica. Like people are causing their own acne from, the 12 steps that young people do at them, now.
The 20-step skincare routine, which has been formulated from TikTok, basically.
But none of them are mothers who have time. They clearly don't. They have the time in the world to do all of this. Well, once you're a mom, you don't have time for 8 steps.
And it's never the mums, is it? Because we don't have time.
Yeah.
So it's the younger gen who probably don't need it.
Exactly.
Yeah.
And I say to them, come for your consultation. If you bring a bag of everything you use, and it's hilarious, I'll come with a bag this big, and I take it all out, and I'm just looking at them like, how do you have time to do all this?
Yeah.
Yeah.
And I always, educate them and say, this is causing your breakout. Nothing else. You
Yeah.
don't have sensitive skin. You have sensitivity from putting all this on your face. Let's strip it right back down. 1, 2, 3, gentle everything, and a barrier repair. Come back in a couple of weeks. We'll have a look, and you can see the difference immediately.
The irony of it.
Yeah, absolutely.
I think we've busted some myths, and that was all really interesting.
Amazing.
Thank you.
Well, thank you so much. And we'll tune back in next week for another episode of Skin to Skin, Face to Face.